In the fifth and final section of our lecture, facial nerve and disorders, now we will talk about hyperkinetic disorder and surgery. In this section, we will talk about hemifacial spasm and surgery of facial nerve. Hyperkinetic disorder of facial nerve. As the name shows, hyper is excessive, kinesis is for the movement, hyperkinetic disorder. And in this disorder, there is excessive involuntary twitching of facial muscle on one or both sides. Because it's hyperkinetic, there is exaggerated movement of facial muscles leading to twitching or facial muscle on one or both sides. You can see it can be one side twitching of the eye muscles, facial muscles, all that, and there is also drooping to one side of the face. It can be one or both sides. Hemifacial spasm. Now, again, this is also self-explanatory. Hemi means half. Facial is for face and spasm of the muscle. In this, one half of the muscle is affected or only on the one side. Characterized by repeated uncontrollable twitching of facial muscles on one side. So in this, there is uncontrollable twitching of facial muscles on one side present. It can be essential or idiopathic. Secondary treatment is botulinum toxin is used for this muscle twitching which is present on one side. Blepharospasm. Blepharo is for the eyebrows. Blepharo twitching and spasm limited to orbicularis oculi muscle on both sides. So in this there is twitching of the eyes is present due to orbicularis oculi muscle involvement, usually on both sides. Treatment for this condition is also botulinum toxin. Decompression of the nerve is performed if the nerve compression is present and if it is compressed. So this is the arterial compression under nerve, auditory nerve, and this is facial nerve. If compression is present, nerve may be compressed by edema, hematoma, or fractured bone in its intratemporal part. So if there is compression of the nerve, that can cause that, which is causing the problems and paralysis and all that hyperkinesis or hemifacial spasm, all these. If there is compression of the nerve, then decompression is performed and then pressure is released from the nerve and it can make the condition better. Bony canal is exposed, sheath of nerve is slit and it can be decompressed. Then another procedure that can be performed is end-to-end anastomosis in cases when there is injury of the nerve. Done when gap between the ends of the nerves is few millimeters. Then what happens? If the gap is less in between the damaged nerve, then it can be joined together and simple anastomosis or joining can be done. This is end-to-end anastomosis. Here, a small gap, it can be combined and anastomosis is done. Here, the gap is repaired by anastomosis. This is end-to-end, how this end-to-end anastomosis takes place. What are the steps? Suitable procedure for extratemporal part of the nerve. So in this, this end-to-end anastomosis is important or effective or suitable for extratemporal part of the nerve. Should not be any tension in the approximated end. It's very important when end-to-end anastomosis is performed or joined, there should be no tension, because this tension can cause the breakage of the anastomosis. So ends should be free of tension. If the gap between the two severe nerves ends is bigger and it cannot be repaired by end-to-end anastomosis, then the nerve graft is usually performed. And the graft is taken usually from the greater auricular, lateral cutaneous nerve of the thigh, or sural nerves. These are the nerves from where we get the graft for the nerve grafting of the facial nerve if the ends cannot be repaired by anastomosis. In the bony canal, the graft is usually may not require any suturing, and suture should not be done if it's in the bony canal. Then hypoglossal facial anastomosis. Hypoglossal is the nerve and facial is also, both these are the cranial nerve. So hypoglossal facial anastomosis, the hypoglossal nerve is anastomosed to the damaged peripheral end of the facial nerve. If you see in this diagram, we have hypoglossal nerve, we have facial nerve, and then it is anastomosed with the facial nerve. This is known as hypoglossal facial anastomosis. It improves the muscle tone, permits some movement of facial muscles, and expense of atrophy of tongue on that side. So in this hypoglossal muscle, it is supplying to the tongue. So when the anastomosis between facial and hypoglossal nerve takes place, usually it affects the tongue and it causes atrophy of the tongue on the affected side. But it improves the muscle tone and it improves the movement of the facial muscles. And then the last procedure which can be performed to mainly to improve the cosmetic appearance of the patient when nerve grafting is not feasible, or when it is performed but it failed and didn't improve the patient's condition, then plastic procedures are usually perform. Different apparatus or equipments available for facial or plastic surgery procedures. We have facial slings that can improve the facial appearance, and then also the surgeries like facelift procedures or slings of masseter muscles. These are the masseter muscles which on which the slings can be used or applied to lift the face. So this is again nowadays common procedure. People perform it even when the muscles become loose, and to improve the cosmetic appearance of the face, they do the face lifting. But there is limit until which this procedure can be performed. The other is the lift of temporalis muscle. This is the temporalis muscle. So all these are the procedures that can be performed to improve the cosmetic appearance of the patient if other surgical procedures fail or they cannot be, they are not feasible. So this was all about the different surgical procedures for the improvement or for the treatment of the facial nerve if it is compressed or if it is damaged or if it is injured. Thank you for watching sqadia.com.